Since the start of the school year, we have seen Central Texas school districts struggle with rising COVID-19 cases. And one of the metrics of trying to slow the spread of the virus is knowing you have it in the first place. A popular way to do that is at-home COVID test kits. But just how reliable are they? Well, Dr. Lisa Gall from Texas Children's Urgent Care joins us now to answer that. And before we do that, Dr. Gall, before we get into the accuracy of these at-home kits, we need to talk about the different types out there and the ones approved by the FDA. So take it away, Dr. Gall.
Sure. So currently these at-home or self-test kits are going to be mostly rapid antigen testing, and that kind of tests for viral proteins versus kind of what a lot of doctors' offices are doing. The ones that take 2 to 3 days are molecular tests, commonly referred to as PCR testing.
And of course, those two are approved by the FDA, correct?
Yeah, so they, I believe, are under the EUA, and the FDA website actually has a list of tests that have the authorization for use.
And so how accurate are these at-home COVID kits?
Sure, and being that they're rapid antigen tests, inherently they're less accurate than molecular testing, and so. It really, if you're getting a negative test result, it raises a question of whether or not that's what we would call like a false negative, where, in fact, you have the SARS-CoV-2 virus or COVID-19, but the test isn't picking up. And that's where by doing a kind of like a follow-up molecular test or PCR test, you can kind of confirm those results.
And so at what point should people rely on these kits versus going to the doctor then?
Sure. I think there is the element of convenience, right? A lot of them are a little bit more affordable. It's like direct to consumer. You can get it at retail store or pharmacy. The convenience being that you can do them at home, or if you're traveling to somewhere, wherever you may be. Again, I think, or if your child is sick and you need to get you can't really kind of get them to the pediatrician's office right away. I can see the value in maybe testing, and if the result is positive, you kind of can rely on that result. I'd still recommend, if you get a positive result, that you call your child's pediatrician and kind of talk to them, because your pediatrician will want to know, how your child's doing, symptoms, how to manage care, when to bring them in to see them. Now, if you do the test and your child's test is negative, I would still call the pediatrician's office and be like, hey, we did this test for whatever reason. It says negative. How can I get a PCR test to kind of confirm these findings?
Okay. And Dr. Gall, finally, at what point, is there a point, a negative COVID test replace vaccination, mask wearing, and social distancing?
Oh, I'll have to leave that up to the experts with the infectious diseases. I think there's a lot of ongoing research, and I think a lot of these tests have come a long way. Before it was hard to even find a PCR test, and now there's a wide variety of molecular testing available. And when the first kind of rapid at-home test came out, right, and those are still evolving. So I think there's much more research happening and kind of science going on to kind of study accuracy. And I think as time goes on, we'll probably develop better tests and have better results that we can use more commercially.
Dr. Lisa Gall with Texas Children's Urgent Care, we thank you and appreciate your time.